Thanks very much. Good afternoon, everyone. I hope you had a safe and healthy weekend. Unfortunately, I'm not able to give you any good news today. As I had said on Friday, the numbers we are seeing are scary. Friday's record high of 4,249 daily new cases was more than alarming. And while our numbers over the weekend may not have been over 4,000 daily, they were still at a level that should make everyone worried, take notice, and take assertive action. We saw 3,443 cases on Saturday, 3,945 cases on Sunday, and today we're reporting 3,338 new cases. While over 50% of the cases are in the regions of Toronto, Peel, and York, we do see elevated case counts across the province, with the trends in key public health indicators continuing to raise significant concerns. The transmission of COVID-19 is widespread and outbreaks are increasing. In just the last 7 days, we have reported 330 new outbreaks, with over 50% occurring in a vulnerable sector. The percent positivity remains high. Today, it's 7.7%, with the 7-day average of 7.1%. Our hospitalizations and ICU patients remain at record levels, and the number of people who have lost their lives remains unbearably high. In fact, COVID-19 morbidity and mortality are at the highest levels we've seen since the start of the pandemic, and our hospital and ICU capacity are under increasing pressure and strain. We're also now seeing the impacts of the holiday season. There was substantial growth in the period between Christmas and New Year's. And in the coming days, we will continue to see the impact of New Year's Eve as we approach the 2-week incubation period this Friday. Urgent action is required to address these worsening trends in our key public health indicators. Cabinet will be considering a number of recommendations later today. And tomorrow we will be able to provide you with not only our new modeling projections, but also specific details about what measures will be put in place. It's not going to be an easy few weeks, but what these trends demonstrate is that further actions are necessary, and we must all continue to follow the public health measures in place in order to get transmission of COVID-19 under control. And with that, I would like to turn it over to the media for questions. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Randy Rath, CHCH TV.
Hi, doctors.
Hi.
There's been a lot of criticism of the government not implementing further restrictions before tomorrow. Would we be in a better place? Would deaths be avoided if your recommendations had have been and further restrictions been acted upon before tomorrow?
Well, what I will say is that placing restrictions on society is a very serious matter with a lot of considerations, both benefits and risks. So they need to be considered and reflected on in a very serious manner and not rushed through. So we will be hearing tomorrow what the measures are. But in the meantime, if people were just follow the basic public health measures that we have repeated many, many times, that is what will, in the end, help us reduce the infection. Keep away from people that are not in your household. Wear a mask all the time. Don't go out if you're sick. Wash your hands. Those things, those are the most important things that everybody has to remember.
Follow-up?
Okay, aside from congregate settings like long-term care homes and parties that took place, household interactions or multi-household interactions over the holiday season, where is the spread coming from in the province?
Well, there are certainly an increasing number of outbreaks, as you said, in congregate settings, particularly long-term care and retirement homes, as well workplaces. have become quite a source of infection. Places where people may be congregating during a break time. They're having coffee. They're obviously not wearing a mask. Carpooling, which can be a concern. Those kinds of things. And social gatherings, of course, either at home or in somebody else's house. We have seen through preliminary findings from surveys that about a third of people in Ontario say they're not following public health recommendations, and they are moving about and they are congregating with other people. And it does seem very innocent at the time, but unfortunately, that's how this infection is spread.
Next question.
From Rob Ferguson, Toronto Star. Please go ahead.
Hi, Doctor. We've
Hi.
been told today that curfews haven't been recommended, and I'm just curious as to. I'm not advocating for them. I'm just wondering what about them doesn't work.
Well, unfortunately, there isn't very good evidence one way or the other about whether curfews work or not, to my knowledge. I mean, fortunately, we haven't had that many pandemics to evaluate the effectiveness. We have looked certainly at the measures that have been put in place in other jurisdictions, other countries, and curfews have been put in place with multiple other measures. So sometimes it's hard to, figure out what part of that effect was from the curfew versus not, and all the potential negative implications of a curfew, the enforcement requirements, the potential stigmatization of certain neighborhoods. So I think it was a serious consideration, but at this point I understand it's not going forward. But there are other serious measures being considered.
Follow-up.
Thank you, Doctor. And just to your point that about 1/3 of people say they're not following public health recommendations, and your advice for people just to follow them. A lot of observers have noted that having things as guidelines instead of laws, rules, bans, whatever, probably hasn't helped. Do you think that the province needs to have these things more officially mandated and enforced for people to pay attention? Or, in the absence of that, what is the solution?
Well, I certainly think that enforcement needs to be increased to ensure compliance. I think people need to take this very seriously. And I think for certain communities, there are measures that are in the works around making sure that the information is translated into a language or cultural sensitive language that they can understand. Looking at paid sick leave, looking at prohibition of evictions, all sorts of measures, isolation facilities to facilitate people cooperating and complying with public health measures. So it isn't just enforcement, it's supporting people so that they can do what's right for public health.
Next question.
From Christina Tanelia at CP24. Please go ahead.
Hi, doctors. I'm wondering if you can elaborate on how concerned you are or not about increased public health measures in schools. Do children younger than the age group of grade 4 need to be wearing masks? Is that something you're considering?
Schools are a very important aspect that we are seriously looking at with collaborating with the Ministry of Education. We know that schools are extremely important for social, physical, and mental health well-being of children, obviously for their learning needs. And we're hearing a lot about the difficulties that parents and kids are having with online learning. Unfortunately, the percent positivity in children went up quite a bit over the holiday period, as high as 20% in the 12 or 13-year-olds, I believe. And we do have widespread community transmission, so the concern now is that kids will likely be bringing the infection into the school setting. So we need to put more measures in place before we reopen the in-school education. We do know we had a really good experience with schools being open in the fall, September to December, and schools were not a major source of transmission at all. The measures in place were very successful, and we want to build on that experience. So I think masking in younger children is one of the things that's under consideration.
Follow up?
Thank you, Dr. Yaffe. One other thing I want to ask you about is, of course, you started off this news conference acknowledging that you don't have any good news, and there's been a lot of doom and gloom news lately. Moving forward, though, is there a benchmark, a number? And what I'm getting at is the criteria for when you say, okay, we're looking good here in the province, we can relax some public health measures. What is that? Because we were doing really well toward the end of last summer into the autumn, but what's the number set at? Is it 100 cases a day in the province, for example? What's the benchmark?
Well, I don't know that I can give you a number. I think the good news is that we're vaccinating people, and obviously, as we get more supply, we will get more vaccine into arms. And we are prioritizing the most vulnerable, long-term care workers and residents, high-risk retirement homes, the Indigenous communities, people who get chronic home care. And so the aim of that is to reduce illness and death. Those are the populations that are most at risk, and obviously with healthcare workers working with in the hospitals, in ICU, emergency departments, COVID units, and so on. So I think the best news will be as we get better coverage with the vaccine, and eventually, hopefully, get to some sort of herd immunity, which we believe probably will have to have 60 or 70% of the population vaccinated. So in terms of numbers of cases, I can't say once we hit X number, everything will be great. We need to keep monitoring very carefully, especially now with the emergence of variants. We have had 6 confirmed cases of the UK variant in Ontario. We are very carefully monitoring if there is any spread of that, because that is about 56% more contagious or infectious or transmissible between people. So that is a concern. There's the South African variant that has been identified in Alberta, and there may be other variants. It's a virus. Viruses do mutate. So we have to keep on top of it.
Next question.
From Scott Lightfoot at CTV News.
Dr. Yaffe, you just said vaccines were the good news, and I don't want to be a downer, but at least one hospital in Toronto is out of vaccines. They've been waiting for days for more, and in the meantime, they can't run their vaccination clinic for frontline workers. There are other hospitals here saying they don't have confirmation when the next shipment's coming, so they're not booking appointments in the future. Are you concerned by the fact that some places have run out of vaccine supply so early in this vaccination rollout?
Well, obviously, we would like the vaccine supply to be steady and scheduled such that we know exactly when it's coming. And I know the federal government's doing everything they can, working with the pharmaceutical companies to enable that to happen. And I'm confident that we will have enough vaccine. There will be bumps along the road, such as right now, as you mentioned, with one of the hospitals. We're also looking at potentially moving vaccine between sites to enable the most vulnerable high-risk people to get vaccinated with the supply that we have.
Follow up?
These bumps in the road that you call them, these hiccups, are they sort of to be expected, or are you concerned that there could be larger issues when this vaccination goes on a massive scale, a provincial scale for all people instead of just the small groups that are being considered right now?
Well, I think that once the supply gets larger and more steady, public health units will be in charge of coordinating and implementing the vaccination program, as they are with, for example, the influenza vaccination each year. Probably options will include vaccination through primary care, vaccination through pharmacies, potentially mass vaccination clinics. And so then again, obviously vaccine supply is critical, but I'm confident that it will be quite good at that point.
Next question.
From Jeff Gray at the Globe and Mail.
Oh, hi, Dr. Yaffe. I just wondered, you mentioned that there are stronger measures that are being recommended. You listed a few that you would like to see, I think. Is there any more you can tell us about what kind of thing we're going to see tomorrow? We're not seeing a curfew, but other sort of drastic measures to try and contain this thing? What can we expect?
Well, what I will say is obviously the numbers are very concerning, and frankly, they're scary. So the number of cases is going up, the number of hospitalizations is going up, the number of ICU bed with COVID-19 is going up, and the number of deaths. And so we do believe that based on the data, which you will see tomorrow with the modeling, that we are in a serious situation and serious measures need to be done. And those are being considered by Cabinet today and will be reported out tomorrow.
Next question.
From Cynthia.
Oh, sorry, Jeff. Follow up?
Oh, yeah, just quick follow-up. About the variant, we're still just the 6 cases found? I mean, it just seems that we hear more and more in other countries of that more transmissible variant. We still only have 6 confirmed cases of it?
6 in Ontario, and I know that the lab is really looking hard, particularly at any case in a recent traveler or in a super spreading event, and also doing random sample testing. So yes, to my knowledge at this point we have 6, and there are I think there's 14 across the country at this point.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hi, Dr. Yaffe.
Hi.
The government has taken a lot of criticism for taking too long to make these decisions, and I recognize that you said that they're not easy to make and a lot has to be considered before you act too quickly. But I'm wondering if we look at the data from the weekend of December 19th, I'm wondering if this clearly shows you did not act, or the government did not act quickly enough. In the last modeling on December 21st, it showed that the faster a lockdown was implemented, the more cases that could be prevented. Instead, the government waited until Boxing Day. So it left the weekend of the 19th for people to go out, do lots of shopping. 10 days after the 19th, hospitalizations notably started to climb. Before that, it took 25 days to increase by 400. After the 29th, 10 days after that shopping weekend, it took only 10 days to increase by 400. And the positivity rate in that time frame almost doubled. So does that not show that it is important to act quickly?
It is important to act quickly, but I think, if you look only purely at the rate of COVID-19 transmission, that's obviously what people are concerned about. But there's also all the other impacts of all the measures that the government needs to take into account, the decision makers, in terms of social well-being, the economy, mental health, and so on. So obviously, if the sooner the measures are put in place, the better in terms of basically just looking at the rate of COVID-19. But again, there's so many other considerations to be taken into account. And the bottom line is people know what they should be doing. And, I think the bottom line is we have told them over and over again. And, it's a shame that we have to wait for government to force them into doing the right thing.
Follow up.
Let me get back to the curfew for a moment. I know that it is not going to be part of the recommendations, but I'd like to ask, is that because the health recommendations from your table don't believe it's necessary, or did Cabinet decide it was not necessary?
It's my understanding that it was not recommended by the health table.
Next question.
From Derek Dioneri at CBC. Please go ahead.
Thanks, doctors. So I know we just touched on, curfews, and there's been a lot of conversation around that. But one thing I wanted to ask specifically is whether you support imposing that curfew, not just specifically across Ontario, but in regions that have higher cases, like, say, Toronto. Why or why not?
I think that there's always the pros and cons of, do you implement measures across the whole province where it's clear this is exactly what's happening everywhere? Do you put it regionally where perhaps it makes more sense, but then people can move between regions? How do you control people traveling between regions? And obviously these are the decisions that we would make in consultation with the local medical officer of health, who is very aware of what's going on in their local jurisdiction. So it's not a black and white thing, but generally speaking, the most important thing is really to be clear about what the measures are and make sure people understand them.
Follow up?
And, you mentioned earlier that there were some options on the table as far as non-enforcement restrictions. What are some of the other or newer restrictions that you think the province or city should be introducing? And are there other places, globally that you've looked at, that you've seen that have worked with good results?
Well, as I said, we've looked at jurisdictions across the world. And obviously in other provinces in Canada as well. And in each instance, they've implemented different combinations of measures in different situations. So it's hard to say, okay, if you do, here's the recipe. If you do A, B, and C, then the numbers will go down. And we have, our own unique epidemiology in Ontario. The regions are different, as was just discussed. So we need to look at a variety of measures, and those are all being discussed at Cabinet.
Last question.
From Graham Richardson, CTV Ottawa.
Hi, Doctor. I keep hearing from you and Dr. Williams, if people would just do what they're supposed to do, we'd be in a better shape here. Like, with respect, this is not just the public's fault. What responsibility does the health table take here for not effectively, clearly, repetitively messaging millions of people? Because it's not all their fault. Surely the health table takes some responsibility here too for where we are.
Well, if you say, well, whose fault is it? It's not really anybody's fault. It's the virus's fault, right? The virus that's very good at spreading between people. I think, obviously we are trying to get the messages out as best as we can, both through things like this, press conferences, through our websites, through social media, and also working with high-risk neighborhoods to get community leaders involved. And it is a multifactorial situation, obviously. It's not like one thing will fix it. If that were the case, we would have done that already. So, I hear you. It's definitely, I'm not trying to blame people. I'm saying everybody needs to remember what their role is. And we need to help people. We need to support people. Things like sick leave pay, enabling people to take time off work, enabling people not to worry about where they're going to get their next meal or their not get evicted. So there are many, many, many factors involved with this, and that absolutely is recognized.
Follow up, and this is the last question.
And I appreciate that, but this is several times, Dr. Williams several times, and yourself several times, you have said if people just do what they're supposed to do. And I would just submit to you, I'm not a scientist or a doctor by any means, but I am a communicator, and people out there are absolutely confused. It's constantly moving, constantly changing, and then when they hear from the top of the health table, well, people just aren't doing what they're supposed to do. That's not all on them, surely.
Well, you're right. If people are confused, they need to get the right information. And I do know I was speaking to a friend the other day, and they said they were unclear about the bubble of 10 people. And I said, oh, we're not doing the bubble anymore. The bubble was previously. Now we are saying stick to your household, stick to the people you live with. And so that was a recent example that I personally saw where people are confused. And we have to keep doing our best to communicate that information, and it does change, and it is difficult, and everyone has to do their best.
Thanks, everyone.